Welcome, everybody. I'm Dr. Hamilton. I'm the medical director for Telemedicine's Nexus letter service, as well as the medical diagnostic service. And wanted to spend some time talking to y'all today about the differences in the two teams, and also try to answer any questions. I know from time to time, I'll get veterans that I'm seeing for medical diagnosis, and then they realize, oh, they have the diagnosis. They actually need the Nexus letter team. And it's a little tricky because as the medical director, I'm involved in both the Nexus letter team and the medical diagnostic team. But we do keep those services separate intentionally. And the reason behind that is that I want to make sure that there is objective and independent opinions being provided on both the diagnostic side and the Nexus letter side. So if I'm seeing a patient for instance, migraine headaches, I'm not going to be writing that Nexus letter. I want to make sure that someone other than me on the Nexus letter team is doing that Nexus letter. I want there to be a separation of services. And we spent a lot of time looking into how we can maximize that objectivity to maintain the independence and the strength of the medical opinion on both the Nexus letter side and the diagnostic side. So that's why those services are aligned but separate. And it's very intentional in nature, because I want to make sure that all of you who come to see us for medical diagnosis or for a Nexus letter know that you're getting a strong, independent medical opinion that's not incentivized any way, shape, or form. So that's why we have those services separate. Now, as the medical director, I am involved in both. So I keep close contact with my Nexus letter team leader, Tara, who's doing a fantastic job. I also keep close contact with my diagnostic team leader, Sabrina, who many of you probably know both of them. And they're doing fantastic work on both ends. And it's been a privilege to work with them. We've got those two teams designed so that we can better serve you. The other thing is, I do primarily diagnostic work, and that's just kind of how I fell into it. And the Nexus letter team, again, run by Tara, their focus is on creating and working through the Nexus letter. And we work closely so that we can maximize your outcome in terms of efficiency and time. So I don't want my Nexus letter team also burdened by trying to do diagnostic work and vice versa, so they can be as efficient as possible. And so far, that's worked out really well for us. Now, want to take a minute to talk about the differences in our teams. And I know there's some confusion there sometimes, and that's okay. It's understandable. It is confusing, and so we want to talk through that. If you, the veteran, have suffered from X symptoms, say headaches, that's a good common one that we deal with, then you want to look to see if you, A, have a diagnosis in your past medical history of any type of headaches, tension headaches, migraine headaches, cluster headaches. Those are some headache symptoms and diagnoses that you might have in your files. If you've got that diagnosis in your records, you most likely do not need the medical diagnostic team. So my team, me and Sabrina, you're not going to need our team. You're going to need the Nexus letter team. You're going to need Tara and her team for the Nexus letter. If you say, you know what, I've been having headaches for years and no one's ever really, I comment on them, I've mentioned them to my doctor, but no one's really ever said anything. I've really never had a chance to explain the severity, talk about the duration of these headaches, the extensive, problems they're causing me. If you've sort of had that where, oh, I've just been dealing with it, I thought it was one of those things that happens, then you most likely don't have the diagnosis, even if you've mentioned it in passing to your physician. That's when you would need the medical diagnostic service. That's when you would need my service. That's when you would need to talk to Sabrina and or me in our medical diagnosis team, so that we could talk to you about, okay, tell me about your headaches. When are you experiencing them? What do they feel like? How long are they lasting? Are there any red flags? And that's the other thing, whether it's headaches or irritable bowel or GERD, there are certain questions that we are by design asking you to make sure that there are not any red flags. And I say that because my background training is in emergency medicine. And I know I've talked to several of you, but I'm board certified in emergency medicine. And when I'm not working with the veterans, I still work in the emergency room, which has been kind of crazy with COVID. But I say that because some of the questions that I'm asking you are less geared towards establishing the criteria for your diagnosis, although that's important. But equally important to me is making sure you don't have some red flag, that there's not something about your headache that makes me concerned that you're having something super dangerous that you need to go to the emergency room right now. And I usually tell people, because of my training, I usually kind of think of the worst things first, but I want to make sure you're safe. Sure, we want to make sure that we're completely evaluating you to make sure that you've got the criteria, so that we can establish a diagnosis, but I want to make sure you're safe. So that's why some of our questions are geared towards making sure that you're safe, that you don't have those red flags for whatever symptoms they are. So that's why we need to have that conversation about, what does the headache look like? What does the GERD symptoms look like? Talk to me more about the pain, the discomfort, how long it's been going, how many years have you been suffering from it? Those are the things that you may have mentioned in passing to a primary physician in the past, but never actually had a formal diagnosis. And so in order to proceed forward with a Nexus letter, we've got to get you a formal diagnosis. Now, you obviously would have to have the criteria. We have to objectively be able to say you meet the criteria for migraine headaches or for gastroesophageal reflux disease, whatever the disease is. You've got to have the criteria for it. Then we can proceed forward with referring you over to our Nexus letter team so they can start working on, okay, does this diagnosis now meet service connectability? And that's where they're going to dive deep into the service records, into the literature that they work on tirelessly to make sure that they are doing good, independent, solid review of your information and putting together an excellent independent medical opinion to determine whether there is service connectability for the diagnosis. That having been said, when I'm doing my diagnosis or when Sabrina's doing the diagnosis, we are making sure that you've got the criteria. And we're, again, looking at objective criteria that state, okay, based on the information you were providing, you do or do not meet the criteria for this particular diagnosis. And of course, like I said, we want to cover to make sure everything is safe as well. And so far, I haven't had to send anyone from the ER from telemedicine. So I'm counting that as a good thing. But we want to make sure that everyone is safe, but also make sure that you do have the criteria. And if you do, then we want to make sure that you proceed accordingly to the Nexus letter team so they can start doing their work in helping you. Now, if you say you have a diagnosis of migraines, but you haven't really been treating it and you haven't really seen a doctor in several years. And how many years is, I don't know. The reason I bring this up is you may actually say, hey, I've got the diagnosis of migraines. And I know I'm using migraines as an example, but we've got 19 conditions so far that we can evaluate for on a first-time basis on the diagnostic team. And we'll get to that in a little bit. But I'm going to use migraines as an example. If you've got a diagnosis of migraines in your medical history that you can pull up the documents, say, hey, here's where the doctor put migraines, I've got that. But you haven't really been treating it, or you've been self-medicating with ibuprofen or Tylenol, haven't seen a doctor in some time, you may end up at the Nexus letter team and have Tara and or one of her team members say, you know what, you probably need an updated history and physical with a physician. And that's where they may refer you to my service so that we can go back through and say, yeah, you still have the migraines. This is, you still have the IBS, you still have the GERD, chronic fatigue. There, like I said, there are 19 that we're working on actively, and hopefully the list is growing. But you may encounter that you're with Tara and or one of her team members, and they say, listen, it's been a while since you've seen a doctor about condition X. Why don't you go to Dr. Hamilton and or his team and or Sabrina, so they can evaluate you to make sure that this is up to date, because we have seen that sometimes the rejections actually have to do with, you supposedly you have migraines back in 98, but you hadn't seen a doctor since then. So do you still have headaches? What's going on here? And that's where you may end up going sort of back, so to speak, to the from the Nexus letter team to the medical diagnostic team. So hopefully that was clarifying and helpful in giving you a little bit of an overview in the differences between the medical diagnostic team and the Nexus letter team. Both are essential. You've got to have both pieces to move forward. But I want to make sure that you're in the right place. And one of the questions that I get from time to time is, how do I know if I have the diagnosis? Well, like I said earlier, if you've got in your medical records a formal diagnosis from a physician that lists on it'll either be diagnosis, might say assessment, that term would be the diagnosis for whatever condition, migraines, GERD. If you've got that, then I would recommend you and your veteran coach go straight to the Nexus letter team. There may be a chance, although I think it's small, but there may be a chance that the Nexus letter team will say, look, it's been a while since you've seen a doctor about the migraines or whatever the condition. Why don't you go see Dr. Hamilton and let's get that updated. You certainly do not have to, but just be aware that may be something that comes back and they say, look, you haven't seen a doctor in a while about this. We need, and we have seen the VA say that it looks like this is an old diagnosis. Is there still some relevance here? So just for your information. But hopefully that gives you some overview as to the two teams. And we want to make sure, again, we're keeping ourselves working forward so that we're helping you and we're getting you into the right place. So, hey, I've been having these headaches for a long time, but I don't think I've ever had a diagnosis. That's me. That's Sabrina. That's the medical diagnostic team. We'd love to see you and talk to you about whether or not you have the criteria for the particular symptom, the particular diagnosis that you're wanting to be evaluated for. And then once you've done that, we're going to make sure you get set up with Tara and or one of her team members on the Nexus letter team so that they can dig deep and start doing work for you there. Let's take this time to transition, and I'm going to put up the 19 different diagnoses that we are currently evaluating for. And I'll say this, we started with 12. So we've grown, and I certainly owe a big thanks to Sabrina Vizzini, who is my lead physician assistant on the diagnostic side for Telemedica. She's been doing awesome and has helped me grow this list from the original 12 or 13 that I started with all the way out to 19. And as you can see, we can evaluate for everything from erectile dysfunction to Meniere's disease. We see patients with irritable bowel, with GERD, headaches of all types, whether it's migraines or tension headaches. We can evaluate for chronic fatigue and fibromyalgia. We can evaluate for female sexual arousal disorder, as well as patellofemoral syndrome. We see veterans to evaluate them for lumbosacral, as well as cervical radiculopathy, strain lumbago. We have evaluated chronic tonsillitis as well as chronic pharyngitis, tinnitus, plantar fasciitis, like I mentioned, radiculopathy, and also peripheral neuropathy. We have the chronic multi-symptom, often noted as the Gulf War syndrome, which usually more recently overlaps with the chronic fatigue. As well as some skin conditions, which we're able to evaluate for. The telemedicine platform is growing. And if COVID has done anything good, it's actually helped telemedicine. That is one thing I will say has really benefited from the COVID pandemic, and maybe the only thing, but we are able to evaluate more and more on the telemedicine platform. And as long as your video feed is decent and I can see the skin place, we can evaluate for that skin condition. Now, obviously, I wouldn't be able to touch it, wouldn't be able to see the texture of it, but I can do what I can to have you describe it to me, and of course, the visualization as well. Vertigo and Meniere's disease, again, round out the 19 that we evaluate for so far. And these are diagnoses that we can evaluate for on a first-time basis. Certainly, if you have conditions that you're unsure about or symptoms that you're like, hey, I read that this might fit into this, but it's not on the 19, please email us and ask. I mean, worst case scenario, we can't do it. Best case scenario, yeah, we get to we get to add 20. And so now we have, 20 that we can evaluate for. So we're constantly trying to evaluate this list, expand this list, and see what we can do to help you. We want to make sure that we're doing it in a safe fashion so that, we're not overstretching ourselves, because again, I love telemedicine. It's great. It's got a lot of appropriate places, but we got to keep it in that appropriate realm. And that's just to make sure that you're safe, because there's certain things that are always going to need an in-person physical exam. And then hopefully as COVID settles over next month, a year, well, I don't know when, honestly, but hopefully as it settles, we'll actually maybe even be able to branch out and have some physical locations. And you'll be able to go in person to do some of these exams that require an in-person physical location. So I've been talking, and I want to stop, pause, see if anybody's got any questions that I can answer. I'm hopeful that I've given you some insight into the differences between the Nexus Letter team and the medical diagnosis team, and when you need which team. Of course, you can always ask because it is sometimes clear as mud. So we want to make sure we do what we can to keep our communication open with you and help you get set up with the right team to the best of our ability. But does anybody have any questions at this time? So the question here has to do with service connected for ulcerative colitis and a route through GERD. So the answer is most likely no. There's not a route through GERD. You can easily have GERD, but it is not. It's going to be a separate condition from the ulcerative colitis, and they're not going to most likely. They're not going to overlap. That's not to say that the symptoms don't overlap, but the pathophysiology is not going to be consistent with one causing the other. It's going to be independent. So again, we can evaluate for GERD. If you've got imaging, we can review the imaging for ulcerative colitis and we can confirm that. But obviously I can't do that imaging on telemedicine. Other questions? We cannot diagnose sleep apnea. We can confirm it. And let me take a minute to talk to you about the difference there. So sleep apnea requires a sleep study test. So you'll actually have to either go to a sleep center where you'll sleep and they'll hook you up and they'll monitor your sleep patterns, or you will take a sleep machine home with you. And some are as simple as a nasal cannula that hooks to a headlamp, or not a headlamp, but a headpiece where you sleep on it for a night or two, and it records information and sends it electronically to the physician evaluating the test. I'm not a sleep doctor, so I don't have the credentials to do sleep studies. We don't have the capacity now to send out, home sleep study kits, and I'm not sure if that's something that we would ever be able to do. What we can do, though, is if you've got a sleep study that you've already done the test, I can review the test. I can confirm that there is sleep apnea noted on the test. I just can't do a first-time diagnosis of that because I can't do the sleep study. So hopefully that helps give you some insight into what we can do to confirm that the diagnosis exists, whether it's sleep apnea or ulcerative colitis, if you've got the appropriate tests that I can review. Otherwise, I can't do that on a first-time basis. So, good question. How do I know if I already have the diagnosis? So that is going to be one of those situations where you will have a formal diagnosis or assessment that's noted in one of your reports from a physician. Now, that physician could be your primary physician. That physician could be a gastroenterologist. It could be a pulmonologist. It does not necessarily have to be your primary physician, but it does have to be a formal diagnosis noted in one of your medical records. And I guess what I normally hear from veterans is, I've just been kind of dealing with this for a number of years, and I never really thought it was potentially a diagnosis. I thought it was just something I had to deal with. That is most likely something that you don't have a diagnosis for. Even if you inherently know, hey, look, something isn't right. I think that I've got something going on, and I've read online that it really kind of fits in this category. But you don't have a physician who's actually sat down and done the history and physical with you and gone through the questions to confirm the criteria, then you're not going to have the formal diagnosis that's going to be required to move forward with a Nexus letter. So you'll know if you have that diagnosis, if you've had a physician give you that diagnosis or that assessment in one of your reports in the past. Hopefully that helps. What documents do I need to get a diagnosis? Great question. So if you're seeing me for the first time, you don't need any documents. The best way I can describe this is imagine that we're meeting for the first time in the ER or a clinic. When I see my patients in the ER, I don't have anything. A lot of times I can't even talk to them because they're altered for one reason or another. So you don't need any documents. Now, if you're able to upload them, great, that's awesome. This, however, is for the diagnostic team. Once we get to the Nexus letter team, you are going to need those documents, as many of those documents uploaded as possible. And the Nexus letter team will help walk you through which specific documents they need and which they don't. So as far as me, when you see me or when you see Sabrina on the diagnostic team, you don't need any documents. We're going to talk to you as though we're meeting you for the first time. We're going to ask the questions as though we don't know anything about you. And some of that's by design too. Like I know some of you will upload all of your medical information, which is great. But a lot of times, I'd say a majority of the time, I don't look at it until after we talk. And the reason is I don't want any preconceived notion of what to expect. I want to have a first-time independent observation with you, discussion with you. I want to hear your story. I want to hear your symptoms. I want to ask the questions and be as objective as I can be. And it helps me to be more objective in dealing with you if I'm not already sort of have a preconceived notion of what to expect based on, reading your past history. And some of that's, like I said, kind of based on my background. I'm used to seeing patients in the ER for the first time. And so I'm talking to you as though just for the first time. And that's completely fine. You don't need to have any documentation when you're talking to the medical diagnosis team. You just need to be prepared to answer our questions and walk through the history that you've had. And we're going to help we'll help you, guide you in terms of asking the questions and helping you remember and talk through what you've been dealing with. I think the answer to this question, can I submit my claim with only the diagnosis, is yes. We don't recommend it, but yes, you can. If you just have a diagnosis, you can submit your claim. I think that we were doing some research when I was talking to Tara a few months back, and we were looking into some research, and like over 90, I want to say around 94, 95% of veterans submit their claim with a Nexus letter. So clearly there's around 5% who do not, but the same percent, around the same percentage of veterans are successful in getting that the disability rating or increase in rating if they have the Nexus letter as opposed to if they don't. So and that that market research may be skewed depending on who we were looking at, but the point was fairly clear. If you go to submit your claim with only the diagnosis and no Nexus letter, it's not going to be as strong as if you have the Nexus letter. That having been said, you may not need it, and I guess I'm thinking more in the realm of the 19 or so diagnoses that I see. But clearly there are injuries that occur in the line of duty that may not need a Nexus letter that are very clear cut. And that's an area that I'm actually really hoping that your veteran coach can better counsel you on there. my end goal for you is to make sure that you have the best chance of success for obtaining your disability rating by us providing you an objective independent evaluation on both the medical diagnostic side as well as the Nexus letter side. So that when you go to the VA to present your case for your disability, you have the best chance, and that the VA knows, hey, these guys are providing independent objective evaluations, and we can rely on what they're doing and know that they're performing above and beyond. So hopefully that helps. If your claim is denied, we want to know. And the reason is that way we can dig in and find out, okay, what was going on? What was the reason it was denied? We need to see if there is something that was missing on our end, or if there was something that we need to have, included, or if it's like, hey, listen, it just, we need more information on that. But we want to know if it gets denied, because that way we know, okay, here's where, we need to look into more, or do a better job of looking into the reason that it was denied, so that we can make adjustments as necessary. The documents that you're going to need to get a Nexus letter are fairly extensive, so I am going to defer that to a conversation when we'll get Tara on, so that she can talk, as she is the Nexus letter team leader for me, because the documents that you're going to need there are much, much more extensive than the documents you'll need to see me on the diagnostic side. And she will be able to better tell you, as that's kind of what she's been doing for a number of years to help veterans. She'll do a much better job sharing with you which documents you need for the Nexus letter. And certainly they remain in close contact to you. And a lot of times it's like they'll send you an email. Oh, can you also upload this document? And it's not like you have to, have a formal sit down with me, and you might some, but that happens as well. So they can keep those lines of communication open with you, and they'll help you get the appropriate documents uploaded. But I'm going to defer that question about which documents you need to get a Nexus letter. I'll defer that to Tara for another time, when she can talk more extensively about what's needed for the Nexus letter. Well, I'm not sure if anybody else has any questions, but if not, I hope that this has been helpful. I do. Certainly, if you have questions, don't hesitate to reach out to your veteran coach. You can reach out to us, or you can reach out to Telemedica directly through the customer support team. And they, of course, can reach out to me. And if I don't know the answer, I'll find out. And just like I said, Tara and Sabrina have been fantastic leaders for me on both the Nexus letter team as well as on the diagnostic team. So I've got some awesome people that I work with that have been really big help. And I hope that this has been helpful in explaining some of the differences between those teams. I do think that both of us have essential services and provide you with some essential evaluations. But I want to make sure that you're lined up to see the right team. And if you're not, then we want to make sure that you do get lined up to see the right team. So thank you to everyone who is on. I do appreciate it. Thank you for the questions. Appreciate that as well. And like I said, please don't hesitate to reach out if you have questions. I do sincerely hope that this has been informative for you to talk about the different teams. And I know it's tricky because, I'm, as the medical director of both teams, I'll get patients like, oh, I thought you were going to do this. So it is tricky because I am exclusively doing the medical diagnostics portion. And Tara is my lead physician assistant on team leader for the Nexus letter team. So hopefully this has been helpful. I do appreciate y'all being on, and thanks for the questions. Hope everyone is staying safe, having a great summer, and thanks so much. We'll talk to you soon. Bye-bye.